Hello everyone, this is Mahima Chowdhury and today's podcast episode is all about health and healthcare. So to discuss regarding the same, I have Dr. Anitha, who is a senior consultant from Colors Healthcare. Hello doctor, how are you?
Hi, I am good. How are you?
Yeah, hope it's all going good. Today's most of the people, at least personally I feel not most of the people, every single individual are battling some or the other disease in their system. In their this human body process or the whatever the system it is. So one such type of disease that I've come across recently is osteoarthritis, which I'll refer as OA from now on. So according to you, how do you define osteoarthritis in medical form, in medical language?
Osteoarthritis is a degenerative joint disease that majorly affects the tissues in the joints, and the tissue starts to get damaged over time. And majorly this osteoarthritis is the person who are elderly, they will get affected with this OA. Okay. And the major joints what it has been expected to get affected are hip joint, knee joint. Majorly the weight bearing joints will get affected. And they will feel a chronic pain when they are at rest and they don't do any activity, and they are very inactive during that stage. They will feel a very chronic pain. This is what the basic knowledge where people should know about osteoarthritis.
Okay. So now we have mentioned elderly people. This occurs mostly in elderly people. So elderly people also suffer with obesity. So
Correct.
now how is this OA related to obesity? How is this associated with obesity?
See, obesity is a major risk factor in OA.
Okay.
Because generally when we see people with a normal weight have a one time of load in their knee joint. For example, knee is a weight bearing joint, right? When people stand, they will feel a single time of weight over the knee joint. But people with obesity, they will have a high load. Say for example, the 5 times of the load in their knee joint. So the cartilage degeneration will happen for them. More likely they will have OA. Okay.
So by which now we are saying that obesity is also associated with joint pain. So
Correct.
now what is the relationship between obesity and joint pain?
See, that is what people who are more fat,
Okay.
people who take more calorie intake every day will be obese. So obviously when they are obese, the ratio of having osteoarthritis and joint pain are more likely to be on the higher end.
Okay. So OA, what are the findings? When does a person find the findings or the symptoms when the OA occurs? So
See, there will be crepitus, that is a kind of sound where you can hear when you walk, when you climb the stairs and all, you can find the sound in the knee joint or hip joint. So that is called crepitus. That is one of the symptoms where you can find OA. And there will be a slight bony enlargement. Knee pain will be very severe when you have OA. And there will be effusions, that is like a kind of swelling you can feel, and that is all non-inflammatory only, but because of that the person will have tenderness. When you touch the joint, there will be tenderness in the joint, and there will be limited range of motion, which means like when you try to bend your knees, you cannot bend your knees. When the person tries to sit in the floor, that person cannot sit in the floor. When you can see the old age people, they will be preferring to sit in chairs or sofas, not on the floor. And they cannot use a Indian type of toilet. They can use only a Western type of, because the range of motion in their joints will be very, very less. So where it will get more restricted. And these are all the basic symptoms where we can easily find we are getting into a kind of arthritis.
okay. Since we came to know that obesity is acquainted with OA, what are the risks? What are the risks of getting obesity that is related to OA? What are the risks of obesity in OA?
See, 50% of people who have obesity are generally affected with osteoarthritis. Okay, people who are in the normal weight are not prone to osteoarthritis compared to the person who have obesity.
Okay.
In that, if you take that 50% of the people, and mostly the women are affected with osteoarthritis because they have the limited range of motion, and they will get into a lot of hormonal changes after 40 plus.
Okay.
So that is the reason where obesity is highly related to osteoarthritis.
Okay. Since we now spoke about the weight gain and all these things which are resulting in OA, so there are people who are now more conscious about diet.
Yes.
So when people go on to these diets kind of thing, so diet a cause for OA, or what does diet's role in this OA thing?
See, the relationship between diet and OA is nothing but weight. When you have high fat intake, obviously the person will put on weight, which is they will get into obesity or overweight. And overweight in turn leads to osteoarthritis when they are 40 plus or 50 plus of age. So this is what the relationship between the diet and osteoarthritis, which is directly proportionate to weight only.
Okay.
No other relationship with the diet and osteoarthritis.
Okay. Now that a person has identified that he is having a OA, so what are the test procedures for OA? Like what are the from the start point to the end point? What are the test procedures for OA? How do you test for OA?
See, the basic finding for OA is X-rays. When you go for the checkup of X-ray, you can find the difference of joint, the reduction of joint space in the X-ray and the enlargement of the joint. And if you wanted to know in detail about the tissues cannot be seen in X-rays. So to know about the tissue damage around the joint, we have to go for the MRI finding only.
So now you're saying tissue joints, all these things, which results in food also. Whatever the food you take, the food intake you take, or the lifestyle changes you make, or it might be due to hereditary, whatever it is. So what foods during this time should be avoided in case to prevent this thing?
The foods what people with OA should cut down is like fried foods, sugars, dairy products, red meat. Majorly people who have the habit of consuming alcohol, they can quit taking alcohol and quit smoking as well. So these are all the basic things where we have to follow when we have osteoarthritis.
Okay, so we have almost cut down on everything, like the dairy. So everything has been cut down. So what foods they have to take?
They can take more amount of vegetables, fruits, lean meat. These are all the healthy diet where they can get in to avoid their own chronic pain.
Okay, but don't you think that this will eliminate the leafy vegetables or the fruits, whatever it is? This will not eliminate the carbohydrate intake?
Carbohydrate they can have. They can have balanced diet pattern. They can follow it, whereas they can have a little amount of carbohydrate for producing their energy. At the same time, we need not go for the high intake of carbohydrate or red meat
Or protein,
high fat, high protein diet can be avoided.
Okay. So why is weight loss a good option for OA patients who are suffering from, there are people who are gaining weight, but that doesn't occur in the people who have put on more weight, right? It only occurs in people who are of of my size maybe. So that happens, right?
See, the cartilage deterioration, when you put on more weight, if you're not reducing your weight, say for example, you got osteoarthritis when you are 80 kgs of weight, fine. In 80 kgs, in 40 plus age, already you got osteoarthritis. You are supposed to reduce your weight as one of the treatment, it is a first part you have to reduce your weight apart from medication. Otherwise, you have to be in medications for lifelong. They have to take non-steroidal anti-inflammatory drugs for life term to avoid that, to come out of that pain. But when you reduce your weight, obviously the cartilage deterioration will come down, and at the same time the ratio of worsening will come down when you reduce your weight. For example, the weight is now 80 kgs, and when you are at age of 60, if you're not reducing the weight, if you're not following a proper diet, you put on weight and you are at 100 kgs. So there is only one option, you have to go for a knee replacement. That is a surgical procedure. So to prevent all these kind of high-end medical issues or high-end surgical procedure, better to take a initial step itself to come out of that osteoarthritis by doing some knee strengthening exercises that can also help simultaneously by reducing the weight.
Okay. See, by this explanation, whatever the osteoarthritis thing, it will only occur in elderly people who are above
Maximum.
40 or 50 like
Maximum.
that. But now a generation, I'm talking about a present generation, of my age, I suffer with some joint pains or something like that. So do I be like really be careful about those things that which may occur to me? So I'm just asking, like, what is the age group? Osteoarthritis.
Osteoarthritis majorly affect only the elderly people, that is 40 plus. That is what the research says till now. But the thing is, now everybody, we are into sedentary lifestyle. Okay, even the younger generation, like 25 plus age, 30 plus age, everybody, they are in the sedentary lifestyle. Most of the people are in the seated profession. They are not going for a proper physical activity, and they are not going for a gym or walk, cycling, any aerobic exercises you can do. These are all activates your muscle. It will increases the motion to your joints. Whereas when we are lacking in all these things, there are chances in current generation, our individuals might get osteoarthritis in 30 plus itself. And even we can see people telling, like, I have put on weight, I have started getting knee pain, now itself I'm getting knee pain, I'm just 30, I'm just 35, like that they are telling. We are not having healthy food at all. Now everything is processed food only. We don't get organic foods nowadays. So the actual nutrients which a person should get is not being satisfied. So to prevent all these kind of things, a person generally can go for 30 minutes exercise, walk, or swimming, whatever it is, so that the improvement in the joints, like joint motion will happen, the blood circulation will increase, and at the same time we can be out of this kind of medical issues when we are 40 plus.
So if I say I take processed food, I take all packaged food, because I stay alone. I'm living alone.
Okay.
I'm from Bangalore, but I'm in Chennai. I'm working here. So all the time I eat all this packaged food, processed food, condensed milk, all these things. I put in everything in my body, and I'm getting these pains. So you think that the chances of getting OA for me is very is it very early?
Not like that, but see, everybody who's staying out, who's taking processed food will not get OA. OA is not applicable for everybody. It is not 100% everyone will get OA. If you're falling down, for example, at the age of 20 or 25, you're falling down, you have hit your knee. So during that time itself, a small degeneration will happen in your cartilage. When you're not taking care about it, when you're putting more load to your joint, when you grow older, 30 plus, you're not taking care of yourself, you're already having processed foods, and if you're not doing proper regular activity, if you're not going for a regular activity, if you put on weight on the other side, then all these factors will end up in osteoarthritis.
So it's basically being physically inactive and not taking care when you get, like, when you don't identify the issue.
Correct.
So these two result in OA very soon.
Yes.
Okay, now that we have discussed about weight loss is good for OA patients, how do these OA patients, how do they lose weight? Like, I'm asking, like, what is the process of losing weight in this OA patients?
See, minimal activity which does not give much strain to their joint, they can start up with.
Like minimal exercises.
They can initially start with some knee strengthening exercises at home. That is a home remedy, because with the heavy knee pain they cannot go for a walk. If they go for a walk, again the pain will get aggravated, they will have swelling. So before we get OA, we are supposed to do the activity to keep ourselves active. Okay, but once we allow that condition to enter into our body, after that we have to go for a minimal activity which does not strain the joint, and majorly we can concentrate on the limited intake of food, that is the limited calorie intake, so which will help for the weight loss apart from activity.
Okay, so see, if I have a situation now. So there's a person who is having this OA and who is doing a lot of physical activity, and they've got this joint pain, and it's like it's bulged over. So now what is the severity, or up to what extent the OA can affect a person? So it might kill a person?
No, not like that. It is not a life-threatening disorder, but it will make a person restricted to that particular place itself. If you're not getting it treated on the early stages, after 60 years, person might not walk. They cannot walk because they will have a severe pain and they will develop other conditions. So the final solution for the OA patient is knee replacement.
Yeah, it's basically like diabetes. If you do something in diabetes, they say that if there's any wound that occurs on diabetes, and if you just poke it on again, so it will spread to the rest of the body. So it's like that only.
OA is not spreadable and all.
But it's restricted
to one place. It might be on the hip joint, it might be on the spine, it might be on the knee joint, like that. So it is not, it will not spread like diabetes, or it is not a cancerous kind of thing and all. But it is at the same time we have to treat it at the earliest stage to avoid to have a normal lifestyle. Okay, day-to-day activities should not affect it because of osteoarthritis.
I think I've got enough information to live longer.
Live longer happily without having any restrictions. That is how.
Looks like I've got enough information on osteoarthritis. I think like all our viewers, I think they're little bit educated about this, because most of them doesn't know or might not be knowing until we spoke about this now. Hope everyone will stay happy and take care of your health. Thank you.